Hello, everyone. Welcome back to BioNexus Health Podcast. Today, I'm going to be continuing where we left off last time, part 2 of diabetes. If you recall, in episode 100, I spoke about type 1 diabetes, the connection to mold exposure, biotoxin illness, what happens with the hormones, why hormones are disrupted, why there is endocrine disturbances and dysfunction with the mycotoxin mold exposure leading to biotoxin illness. And additionally, it's important to keep in mind, the leptin resistance, insulin resistance that can happen, including metabolic dysfunction and metabolic disorders that are seen in patients with biotoxin illness. So today, let us focus on type 2 diabetes, which is blowing up actually across the globe. Let us go ahead and explore a little bit. It'll be, again, a short podcast. So, you have the time and the energy to focus and pay attention.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Okay, so speaking of, so let's just, dive right into type 2 diabetes. So speaking of type 2 diabetes, it's pretty much insulin defects. I remember, many years ago when I was in school, in medical school, the number of people being diagnosed below the age of 40 with type 2 diabetes were almost unheard of, very rare, right? I don't actually, honestly speaking, I don't recall more than one or two under the age of 40. Today, type 2 diabetes has become so widespread that even young people exhibit laboratory and clinical signs of disease, especially with underlying mold exposure, mycotoxin exposure, and chronic inflammation, biotoxin illness. As noted, as I've mentioned before, type 2 diabetes, the body does not use the insulin correctly. Either the pancreas does not produce enough insulin, or the insulin produced is not able to properly bind to its receptor. In either case, blood sugar becomes elevated, and it leads to a host of medical problems. So, for instance, one example, when glucose is elevated in the bloodstream, it causes the cells to move or shift water from inside the cell, meaning from intracellular, to outside the cell, extracellular. So this osmosis or osmotic shift of water dehydrates the cells. Makes sense, right? Now, a dehydrated cell cannot function properly. It will be unable to produce energy. It will be exposed to increased oxidative stresses. Now, if blood sugar level stays elevated for long periods of time, serious health issues can result, including vision problems, kidney issues, cardiac and cardiovascular system issues, as well as certain impairments of your nervous system. A number of factors can cause type 2 diabetes, but the two most common reasons being eating a poor diet and lack of physical activity. Now, understand that I'm speaking of patients with CIRS, chronic inflammation, mold exposure, biotoxin illness. It makes you tired. There's fatigue, there's weakness, there's illness, and eating whatever is easy and available processed foods, high carb, high sugar diets, drinking soda. This is commonly seen for convenience. And, I can't blame them, but I always make it a point to counsel them to do your best with your diet, because you are what you eat. CDC, or Centers for Disease Control and Prevention, reports that more than 95% of diabetes cases in the United States are caused by these two main factors. What are those? Again, eating a poor diet and lack of physical activity. Even if you can go for a quiet walk, like, it doesn't have to be a brisk walk, can be a slow walk, just walk around the block a little bit, walk around in your backyard a little bit, a few times a day. Just try to stay as active as you can under the circumstances, and try to eat the best you can. Many people with mold biotoxin illness also have IBS, or inflammatory bowel disease. IBD is inflammatory bowel disease. IBS is irritable bowel syndrome. Either of these, it can even lead to Crohn's, ulcerative colitis. So there are many additional things going on when there is chronic inflammation, and you may already have a very limited diet. So if such is the case, just, bring it to my attention during your appointment, and there are always options available. Okay. One other caution: when I say exercise, I don't mean extreme exercise. Understand that if there is hypothalamic damage in the brain, if your leptin receptor is damaged, inflamed, then it really isn't much you can do that will reduce your weight. Many patients complain about being overweight. Many patients are overweight in spite of a lot of activity, a lot of exercise, and extreme diet control, extreme intermittent fasting. That is, healthy up to a certain extent, but certainly not required, and certainly needs to be done with a lot of caution. If your post-exercise recovery isn't good, if your lungs are not able to keep up with the level of exercise that you are indulging in, hoping that you will lose weight, it is just going to be additionally problematic for you. So please discuss that with me during your appointment, right? I mean, there is customized protocols that need to be looked at for every patient, depending on their symptoms, depending on what we find in the labs. Okay, right. Now, let's look at some other factors that can lead to type 2 diabetes. That will include high alcohol intake, any previous history of gestational diabetes, meaning diabetes during pregnancy for women, or for both men and women, having high blood pressure, hypertension. Now, these two forms of, there are two types of type 2 diabetes. One is type 2 diabetes where there is elevated insulin levels, and one where in type 2 diabetes, there is low insulin levels. Okay, now insulin resistance occurs when the pancreas produces enough or even too much insulin. Yet the insulin doesn't effectively control the blood sugar because the cells in the body, their insulin receptors do not respond appropriately to the hormone. I mean, insulin is a hormone, like I had mentioned before. So in the case of your pancreas producing too little insulin. That's where the blood sugar rises, because there is not enough insulin to signal the uptake of glucose from the bloodstream. For many years, the information has been put out there that, for cardiovascular health, eat a low-fat diet. That's all well and good, but what happens when the diet is low-fat? It's usually high carbohydrate, and that isn't good for someone with biotoxin illness, because it can lead to different kinds of metabolic syndromes, type 2 diabetes being one, right? Now, we all know, I've spoken to you at each of your appointments, that good fat, okay, a high fat diet, no, a moderate fat diet filled with good fats, like salmon, cod liver oil, eating wild-caught salmon, coconut oil, coconut butters. So these are some examples. Ghee would be an example of good fat. That is actually cardiovascular health friendly. So just blindly lowering your fat intake, can sometimes lead to eating too many refined carbohydrates. And then the result is entirely predictable, isn't it? You will have insulin issues, you will have weight gain issues. And to that, you add in the leptin receptor issues and weight gain issues that are seen in biotoxin illness, mold exposure, and things just kind of snowball from there, don't they? Unfortunately, Americans are considered to be some of the heaviest people on the planet. And with the most cases of diabetes, a holistic approach, a naturopathic approach can definitely provide effective treatment strategy, depending on whether your pancreas is producing too little or too much insulin. All in all, one thing is pretty certain, that if we don't change our eating habits, it becomes challenging to overcome the diabetes epidemic, isn't it? You are what you eat, as I said before, and if you are meat eaters, then you are what the animal you eat eats. But that is, a discussion for another day. I mean, I guess I could touch upon that briefly, meaning it is best to eat grass-fed pastured meats. For eggs, go for the obviously organic, but look for local grass-fed pastured. That is your best option, especially nowadays. It's a beautiful summertime here, and we have absolutely amazing local produce available, beautiful, fresh, local fruits, vegetables, meats, eggs, chicken. It's just, absolutely amazing, the bounty that Mother Nature gives us. Indulge in that and try eating in season. If you're expecting, fresh mangoes when it is snowing 3 feet outside, and that's unrealistic. That's not healthy. That's not eating in season, right? So another way of eating healthy, low sugar, everything in moderation, is eating in season, right? Increase the fiber in your diet. I was speaking with someone earlier on today that, many people like to eat pasta, just pasta with cheese on top, or like pasta with butter. What is that? That becomes like this paste in your stomach. It's all carbs, and carbs get converted into sugar again. So, try to kind of shake it up a little bit with vegetables, with sausage, with protein, everything in moderation, right? That's the key to good health. And as always, feel free to forward any questions to me, and I will certainly address them. And if you made any observations watching this video for your own health, remember to mention that to me at your next appointment. All right, so this was part 2. In part 3, I will be expanding more upon early detection, prevention, and lifestyle choices. Good. So thank you for joining me. I will see you back here next time. Until then, keep smiling, look after each other, be well. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.